Hey everyone, welcome to the BioBreakthroughs podcast. I'm your host, Jared Taylor. Joining me today is the CEO and co-founder of Dandelion Health, Elliott Green. Elliott, how's it going?
Good. Thanks so much for having me, Jared.
I'm excited to chat with you. Let's dive right in. We'll start off. Would love to hear more about your background and specifically, I know before starting Dandelion, you worked at Oscar, so I would love to also hear when you're talking about your background, that transition from Oscar
Yeah,
to Dandelion Health. But yeah, tell us about yourself and your background.
sure. So, as you hopefully have picked up by now, not from these shores, so that makes the transition to US healthcare probably even a little stranger. I actually started in finance many years ago. Was doing that. Came to New York first, kind of, 2007 for finance. What ended up being the financial crisis. Went back and then came back in kind of 2012, 13, and was one of the early people at Oscar. Um, it was a vertical learning curve into healthcare. I think Mario and the team made a decision of combining what I would call lots of general athletes with kind of lots of subject matter experts across healthcare. Great place to work, phenomenal mission. So did that for about 4 years. Ended up kind of running expansion, strategic partnerships, a lot of the growth stuff. Two big joint ventures, one with Cleveland Clinic and one with Humana. So this kind of got really good education of how do you connect the dots in US healthcare, which is a privilege. Not many people get that kind of overview, but working in insurer, you kind of got to. Um, and then got to the end of Oscar and really was just looking for more experience. And I think what's interesting about the payer and provider space is it's really different from the med device and life sciences space. And they just don't cross over that much, even though you feel like they should. So I actually went to a company called TrialSpark. It's now called Formation Bio. Worked there for a year and just got a really good handle on clinical trials and that idea of how do you kind of attempt to integrate clinical trials into the everyday standard of care. And what became so apparent from that was data. And and so my next stop ended up being a company called Clarify Health, which was taking claims, or still is, from Medicare, and really trying to help patient journeys. And that just gave a really good overview. I kind of like to call it the three legs of the stool in the seat. Payers, providers, life sciences, and then data, which is the thing that kind of combines on all of them. And that took me up to kind of just before COVID, and that was when Dandelion was born. Was one of the really good contacts I had from Oscar was a gentleman called Neam Gandhi, who actually worked at Mount Sinai Health System. And we were trying to work out, we were being approached by various companies, him for data, and they were approaching me to try and help them build their data teams to go out and procure it. And we were like, why is AI in healthcare not moving further? And so we looked into it, and at the same time, we got introduced to a couple of academics, Sendel and Ziad, who were at the time kind of just got a grant and were also trying to find like data to do some very cool experiments. And the four of us just sat there and thought, you know what? There's something here. And actually, if you want AI to take the next journey, as it were, like, and to really evolve, like, the biggest problem we have to solve is data. It's not physician alignment or, how do we work out reimbursement? Sure, all that stuff, joyful as it is, will come. The first thing is we need a data set that isn't just deep, because lots of people have radiology scans or EMR, but is longitudinal. Like, we really need to track large numbers of patients. And so that's what we did. We thought, okay, well, this data lives in health systems, only very specific health systems. Why don't we do the very easy thing of just going and convincing all of them that we need all of their data? How hard can that be? And so that's where we started, and I'm delighted to say 4 years on, we managed to do it.
It's it's not easy, right? So like, but your background um, really, I think, set you up for this opportunity and to build this company, which is great. I'll just quickly say about Clarify, best latte when you go to a conference, when Clarify has their little latte maker, and then they do your name or something, whatever
Yeah.
you want in the latte. The I would love to talk for a second here about a topic we've heard quite a bit this year
Yeah.
and last year, GLP-1s,
Yeah.
and specifically, let's talk about, you recently made an announcement regarding GLP-1s in your data library.
Yeah.
Talk me through what that is and why it's important.
Yeah, so let me pick up the dandelion bit that I left off, which is kind of what do we do once we've got all this data and what problem are we solving for? And so ultimately, the Dandelion is a real world data platform that is focused on precision medicine and clinical AI. And so you can think of that almost as kind of two buckets. So that first bucket, clinical AI, it's algorithmic development, it's working out how to put algorithms back into providers. And then the second bucket, that precision medicine, yes, that's important in there, but it's also very focused on life sciences. And the idea that, what we have in terms of access to the patient data and the insights is it's actually happening now. And it's in terms of patient care, in terms of reaction to drugs. And there's no better example than GLP-1s. And so let me go through that in a concrete way. Our data set is a constant feed from our health systems. It's images, it's waveforms, it's EMR data, it's notes, right? It's the whole patient record. Now, why is that important? That's important because it's very similar to the kind of quality of data you'd get in a clinical trial. Except clinical trials cost an obscene amount of money, take a really, really long period of time, have lots of other aspects to them, as everyone knows. I don't need to go into it. And so GLP-1s, why are they so fascinating? Because actually they're the first kind of drug class that everyone is already convinced is going to be this miracle drug that, whether it's obesity or inflammation, that you start to kind of attack with these things, that suddenly the knock-on effect in other indications is going to be huge. And so that allows you, and so you think, okay, well, how are you going to get all of these drugs approved for other indications? Sure, we've got obesity, we've got diabetes, but now we're talking about cardiovascular risk, which Novo has. We're talking about neurology. There was another article about rheumatoid arthritis. Like, to prove all those things out in a traditional way will take a decade, maybe more, God knows how many billions of dollars. But it's actually happening to patients right now. The only reason people are saying this is because there are lots of people on these things. And so how do you find that out? Well, you find that out with data sets like ours, because that's where the clinical trial level data is. I want to look at rheumatoid arthritis. I want to look not just at the EMR. I also want to look at your images and your scans. I want to look at cardiovascular risk. I'd love to see your ECGs, right? I'd love to have a look at some of the chest x-rays, some of the MRIs. Like, there are so many ways of looking at it. And so Dandelion allows you to see in real time what's happening rather than waiting. And so that's why we felt like the GLP-1 library was so important, because we can solve a problem now that would historically take all of those years and all those billions of dollars.
And how do you determine which things you want to solve for and which things, maybe they get put on a future roadmap, but
Yeah.
maybe you don't address them, right? That's one of the hardest parts about being a founder is you get all this feedback, there's these different directions that you can go in, and everyone thinks they're telling you the best advice, right? Like, even from your advisors and outsiders. And um, how do you determine what makes it to roadmap and what gets shelved until maybe new information comes to light?
So, I mean, there's just no substitute for talking to your client. It's as simple as that, right? So, I mean, the first thing that you have to do is yes, you can have hypotheses, to your point, but even then you have to have only a few. And then you go out and test them. I mean, that's the role of being a founder, right? Just continual hypotheses testing. And so we went out to the market and said, right, we've got this hypothesis that GLP-1s is going to be a big thing in terms of the data set that we have. Obviously, the drug class we'd already worked out. And so we had these conversations asking, well, what if we could solve this problem or this problem or this problem? Would you be interested? And at first, people, sometimes they were immediately like, oh, yes, that's on my roadmap right now. And sometimes like, wow, I hadn't thought about that. And so what you start to get is this mix of problems that are short term in terms of need, like round peg, round hole right now, and things that will be kind of more longer term in terms of it would take people longer to kind of use AI, for example, right? Like, one of our big things is utilizing AI to extract value out of unstructured information like images and waveforms. Not everyone's ready for that. So as we go through that, then we start to filter down, okay, here's our roadmap, and then here's like the staging. And then ultimately the next hardest thing is, what do you say no to? Especially with a data set like this, we have information on everything, but we as of a company have decided that we're going to focus on cardiometabolic only for right now. Like, we have to, because otherwise you just get caught structuring information everywhere. So hopefully that helps. Like, that's the key thing is talk to the customer, establish it, work out your supply.
And what are you most excited about in relation to the evolution of Dandelion Health?
I mean, artificial intelligence is going to transform so many aspects of life, and drug development, drug commercialization are no different. Drug discovery, obviously, people are already doing as well. Um, Someone said it to me recently. The metaphor they had was, clinical trials are kind of like a single street lamp, but when you start using AI, you're about to light up the whole neighborhood. And it's really true. Like there is so much information in all of that unstructured data, right? The images, the waveforms, the pathology slides, that when you start linking it to outcomes, like what you can discover is, I mean, we haven't even contemplated it. And so that's where Dandelion is really going to set itself apart, is that we focus not just on building the pipes to get all of those images out, but on also managing to cultivate the AI aspect of things so that we can bring lots of smart people with lots of amazing algorithms to bear on this problem, ultimately, which should help the market. Oh, I can't hear you, Jared.
I'm really excited for you and the team. And I always say one of the reasons I like to do these videos is because I can see people's eyes light up when they're talking about what they're building, right, and why they're doing it. What's you just kind of told us what's next and what excites you. Are there any events or conferences upcoming that are on your radar that you're really excited about? Where you know this is where people will come up to you and ask you additional questions and also get excited. But what's on your radar?
Yeah, so we've got health. Been lucky enough to be selected for a panel there, so we'll be there. DIA, I think we're going to be at, and then DFarm. Those are our kind of big focuses. Yeah, and I would love to. I mean, as you rightly said, like this topic, I can bore people with for hours. But I mean, it truly is fascinating. Like what we could do. You know, the idea of being able to discover neurological conditions, like from using AI in a fraction of the time. Maybe we could find a way to actually have an Alzheimer's trial that was, you know, before people necessarily developed it, right? By finding signal, those biomarkers in images, like rather than being preventative, rather than being like reactive to a diagnosis, could we be preventative? Like those kinds of things are not crazy. And so, yeah, it's really, really excited to talk about any aspect.
Yeah, I mean, because AI becomes more powerful the more data we can feed it, right? So if we can give it a several thousand or even eventually millions of people that had Alzheimer's, but we were able to track all the biomarkers for 20 years, right? Before
Yes,
that. So I mean, we'll see vast improvements over the next couple years, but think of where we're going to be at 20 years from now,
oh,
right? Like if
crazy.
now everyone's wearing some, people wearing either an Aura ring or an Apple Watch or another device, right? And I think especially in the near future, that'll become some sort of device, even if it's like a clothing that you're wearing that's monitoring your vitals. Now, if we have 10, 20 plus years of data, like think what we're going to be able to do. Um,
Yeah,
yeah, it's really incredible. Like just to see where we've been at in a year since like the vast majority of society has been exposed to AI through like ChatGPT, right? How
yeah,
much it's evolved since then, what is it going to be
yeah,
like in even 2 3 years from now? It's going to be absolutely crazy. So I think it allows us to rethink certain areas
yeah.
about how we can truly transform this. We're kind of in our sci-fi era right now, right? Like anything that you saw in sci-fi becomes more possible now because of AI. So it'll be interesting to see how things progress. But I'm excited for you. I definitely want to stay in touch. I will be at Health, so let's connect in person too, and we'll chat there as well. But if you can find some time, I'm sure everyone's going to be coming up to you and asking more about this because you should. If you're listening, go up, say hi to Elliot, ask him a question, and watch his eyes light up. But Elliot, thank you so much again for joining me here today, and look forward to future conversations.
Thanks so much, Jared. Nice to be with you.